This is The Devil Wears SPF, hosted by Diane Brennan and Carolyn Hawes, for women who moisturize like it's a religion and still forget where they parked.
Hi, everyone. This is the Devil Wears SPF podcast. Thanks so much for joining us. I'm Diane Brennan, along with my beautiful co-host, Carolyn Hawes.
Hi, everybody.
We talk about beauty. We talk about the beauty culture around the world. If you're just joining us for the first time, please like and subscribe. If you go to our first episode, you'll understand why we're doing this. I had a face burn. A doctor burned my face with a laser, and that's how I got interested in skincare. Carolyn's always been gorgeous and interested in her skin, and we've been friends for a while. We decided, hey, there's a lot of women out there that are concerned about their skin. We're at that age range where we have disposable income. We love to travel, and we want to bring beauty treatments around the world to you. So today we are talking about your teeth. When you meet someone, your smile is everything. Teeth play a lot of how we feel about ourselves and our confidence. And we have a wonderful guest with us. Dr. Maria Sokolina is joining us from the city, New York City. And welcome, doctor.
I'm so honored to be here, and I love your mission to promote the beauty to women.
Thank you. Thank you. Yeah. And it's great to have you here.
I don't know about you, Carolyn. Have you ever had work done on your teeth? I grew up with I could suck corn through a picket fence. I had a big space, and it was completely, that's it. In Canada, we used to drink a lot, and I come from Alberta, which is a little bit, oil country, and I learned to squirt beer through my two front teeth. That was my party trick. So I was not confident. And so then I did get my teeth done. So I feel a lot better about that too.
I didn't have quite those talents, but I did have a similar journey. I had braces when I was young, and they didn't work. I had them when I was 14 till I was about 17. So, the best years to have braces when you're a kid, when it's the full thing, and then the nighttime thing that you have going on there. So later in life, my teeth did start to move in. And at that time, I had to decide what I wanted to do. And I just wasn't interested in revisiting braces anymore as a 40-something-year-old. So I did get veneers. And it's going to be a really interesting conversation with you, Dr. Sokolina, because our smiles are something that we don't realize takes such a prominent stand in how we look and how we feel about ourselves, as Diane was just saying about her experience as a kid. We can do all these things with our faces, and yet sometimes at the heart of what we're feeling about ourselves and what we're projecting to somebody else is really that smile.
Dr. Sokolina, tell us where you went to school, where you're from, and your journey to get here.
So my journey started in St. Petersburg, Russia. At that time, when I was growing up, people would put metal on the teeth. We're not talking about porcelain or zirconia. It was metal crowns or gold crowns. Sometimes people put it as a chic element or whatever, but it was a standard of care, if you can call it, in the Soviet time. It was a very limited amount of material dentists can use, and technique was, if I can talk about that, it was very much like a stone age. The techniques I learned when I went to that medical dental school, it's really even embarrassing to talk about. The benefit of that school was what I learned about human body, and I learned how to connect head with the rest, not to treat people as a headless horseman or just a head without the horseman. So I try to do both, especially when I create the beautiful smiles. I consider a lot of other elements, what I'm gonna share with your audience on the podcast. But after I finished my first medical dental school, I moved to United States. I'm Jewish, and a lot of Jewish people moved that time because anti-Semitism and political situation was unstable. Why I moved, I was not able to practice my profession in the way I envisioned it. I really want to create beautiful smiles, and it was not possible that time. And then I start my journey again in NYU Dental School, and they're on totally different type of dentistry, very much focus on this area. And then my journey for beauty started. I want to create beautiful smile, but the one what functionally right, and the one what can last the lifetime.
What do you find women our age? What is their biggest concerns when they come to you?
It's a wonderful question, but really complicated story. So I find different type of concerns, but let's talk about the beauty first. When women come to me with a concern, so the most common concern, yes, everybody want to have a beautiful smile. I try to create it conceptually right. Like I would put it this way. And I know you mentioned your story with orthodontics, and a lot of people come to me after childhood orthodontics. You in the United States had that trend of creating straight teeth without thinking about rest of the face and without thinking about body. Orthodontists thought what patient had too many teeth for the jaw. So instead of making the jaw bigger, they would remove 4 teeth, 4 bicuspid and 4 wisdom teeth to create a stable system. But what I learned, orthodontics did not work. I learned what their particular smile become a jail for the tongue. And then in addition to very narrow, crowded smile, what they don't like and don't feel confident about, they also are very, very tired. And if you tired, it's really hard to create something so beautiful. So they come to me with that concern. And they said, I want to have this beautiful smile. Or maybe all my life I had dental phobia, but now I'm adult. I want to have my dream come true. So I want that. They usually bring the pictures they like. I want to know their vision. And it's usually broad smile like Julia Roberts had.
Okay.
You've made some really interesting points because you're looking at both the aesthetic and the healthy airway that's happening for women. And that was something that I had. I had a bunch of teeth removed when I went to have braces when I was 14. And rather than expanding, so what you're saying, rather than expanding the jaw or the palate, the removal of the teeth has made our mouths smaller, which goes against what
Everything.
we would call aesthetic beauty and healthy airway. How do you start then to plan their treatment of what they're looking for to create a smile for us when we've been through a childhood where often our teeth are removed?
Number one, I started always with a conversation. I prefer to start the conversation in the comfort of my patient home. So I prefer to start with a telemedicine conversation because a lot of people, when they come to dental practice, they feel not good. I want to learn about that person. Yes, it's a very unique concept. Not everybody like that concept. They feel what the doctor have to, examine. They have to look inside, to check every tooth. But for me, smile is part of the personality. It's part of who you are. It's a very technical work, and I'm not a technician. I'm a high-level professional. I want to understand the person behind the smile. I can examine and understand what exactly going on. I can see a lot of problems with the acid reflux. I see, of course, problems with the airway. Can see problems with the immune system. I can see the microbiome. We have a special way to do salivary testing and check what bacteria is in the mouth. There are some bacteria usually appear in the test in case of depression and anxiety, in case of sleep apnea, in case of problem, I would say polyps, colon cancer. I can recommend people to have a colonoscopy because it's the same bacteria. So I can read through the bacteria, I can read a lot of general conditions. And I offer different strategies to my patients. We talk about porcelain veneers or zirconia veneers, and smile gonna get bigger. And a lot of people, they come to me with the grinding, and I can make those short teeth look longer. I can create more space in the mouth with my work, raising up the bite and creating different vertical dimension, considering health of the temporomandibular joint, because teeth are not only teeth. We have a joint here who should stay silent after the treatment, not become like a fire and create headaches and,
Right.
pain in every area of the body. Because if you get the wrong bite, then everything gonna tell you about that.
That's quite incredible to realize what the connection is between the whole body and just the mouth and all of the different ways that you can diagnose things happening in the rest of the body. And the point being that you've made beautifully is that our smile is only going to look as beautiful as we are healthy in our body. And that's going to be reflective of what we're trying to accomplish, which is overall beauty with a smile as well. So with all of that, if you've dealt with the health side of a woman's smile, then how do you start in looking for the perfect smile for them? If it's the whiteness, the alignment, the size of your teeth.
We start with the size, and I use a golden proportion of Leonardo da Vinci, front teeth related to the side teeth and so forth. But I always look at the soft tissue because I consider lips as a frame, and what's inside have to fit into that frame without black spaces. It's not always possible to accomplish, but that's my ideal choice. So when women come to me and we establish what there are no other, factors besides, the way teeth position, and usually people want kind of standard things. They want wide, broader smile. I use a lot of combination technique between orthodontics and prosthetic treatment without preparation of the teeth. I try to create a condition in the mouth, but I can do the restoration without damaging the enamel. I'm talking about people who do have teeth. I can also talk about people who don't have teeth.
I guess that's a whole other topic in
That's
itself.
another
isn't it?
story.
Yeah.
But now in the modern time, it's also can be accomplished, and it's really people somehow live a busy life and they don't want to be connected to the dentist because we are very terrible people. We are kind of tooth whisperers and terrorists, and we, in all the movies.
You heard us. That's why it's painful to go to the dentist. Yeah. So people are scared. And I don't think people understand how important the connection to your health is for healthy gums and all of that stuff. And gingivitis isn't just, a gum disease, but it causes problems in your stomach and other health problems. So people, yeah, you always get put last for sure when it should be much more priority.
I'm so thankful for you inviting me to your podcast because you kind of trying to change that concept. What we are not, those terrible people, how they paint us in the movies. My really favorite show, Little Shop of Horrors. I love that movie. I listen to the songs 1,000 times. And yes, song about dentist is my favorite song. But that's how people see me.
Right. Well, I don't think that bad, but people definitely don't like going to the dentist. What do you see some mistakes that other dentists are doing? I do have veneers, and my dentist was, we have to make it look like a natural white. I wanted those pearly, white teeth, and she kind of talked me out of it. Both of your teeth are a lot whiter than mine, and so I'm regretting it.
It's a good point, though, because what are the different colorations? And I know that I went through the same thing, Diane. I was looking at the palettes of all of the white, which are all just white, but with different undertones. And I was thinking I needed the whitest of the white as well. I was talked through to just do something a lot more natural. When you're looking at a person and you're knowing that there are undertones of pink, undertones of blue that come with the white, it's way more of an artistry than I think most people realize when you're matching the color to a person.
Finding the color for the teeth, people really focus on that, but that's not what, the hardest part, at least how I find it. If you're not doing just one central incise, if you're trying to match left tooth to the right in the front, That's a real artistry. That's true. Because tooth, besides the color, have a lot of other things. It has a whole symphony of things. It has clarity. It has some type of mamelons. It has a lot inside. But a lot of people don't want it. They don't want that natural effect. They want what they see in the media. They want the teeth color of whiter than a North Pole map. And if they want it, I'm all for it. And I always say with the color doesn't make any difference to me. Color is your choice. Of course, according to my artistic taste, I can offer my suggestion. Yes, I usually, if somebody has a teeth, natural teeth, I try to use the natural tone to match and maybe go one shade lighter or two shades lighter than the nature gave you. Because the nature was the best artist, at least how I think. And it according to the tone, according to ethnicity, it's a lot of factors. But, color is something so not critical to me, what I never argue.
Yeah.
You want this color, then I'll give you that color. And it's true, I always do temporaries. Temporary crowns or temporary veneers. I know a lot of dentists don't do them. You ask me what dentists do. So I like the test drive because very often I change so much. Color is not that important to me. I do the temporary, and then the temporary, they change things. They change the way you talk. They change the way you look, just like a nails. And you can say, oh,
Like you're painting the walls, pick a color. But that's really important. So people who are thinking about getting veneers and have no idea, Dr. Sokolina does a temporary teeth, and you wear that for what, a week or two?
usually maybe even longer, maybe 2-3 weeks, because making the permanent, that's a whole artistry.
It gives you an idea of the shapes you want, the colors, and you can kind of try that out. So that's excellent. And then you can adjustments. Awesome.
While we're talking about color, some people, rather than getting all of their teeth restored, they go for like a Zoom whitening. For our listeners who might be using the teeth whiteners at home, are they safe to use or are they harmful to the enamel on your teeth?
This is a very, interesting question. I would put it this way. I understand, but if people using those whiteners, it's important to them because they might have stains from tea, coffee, red wine, and they want to get rid of it. It's also true, those whiteners, they contain a certain percentage of, peroxide, let's put it, something strong to clean those stains. And yes, it's changed your microbiome. But in the same time, you do it from time to time. So I don't consider it terrible. Yes, it's true also what professional whitening can whiten so much better. And it's much shorter, and we use the light to activate that, chemical substance, and we protect you, we protect your gums, we protect your cheek, with the special retractors and, materials. So it would not go into the system because something what we use in the office, it's so powerful.
So that's what happened to me. And if there's a drug or a procedure and there's like 1.0000001% are going to be affected this way, well, that would be me. So I am too sensitive for the things. It felt like razor blades were being shoved under my gums. It was such extreme pain.
It's horrible. Does that happen sometimes?
Whitening. If somebody is so sensitive like Diana, we would offer to have painkillers prior to the procedure. It's best if you take it maybe hour before.
Like I think
you don't feel.
I think I need to be knocked out. It was that painful. Like I
Really?
it was excruciating. I won't even use the Crest white strips because it was such a traumatic experience. It was terrible. Yeah.
So there's so many things to consider. The person's sensitivity to these procedures, the outcomes will be different for everybody. And so as a physician, you're really balancing so many things. It's great to know that you at least give them a test drive of these things too, when they're
Very important.
about to venture into a lifetime marriage with a set of teeth.
Exactly. You put it exactly right about the marriage.
We want to get rid of them sometimes, though. The marriage. Maybe the teeth. I don't know. Sorry, go ahead.
One thing that people are concerned about is Carolyn, when you got your veneers, did they drill your teeth down to little?
Okay, this is a really good one because I was trying to find somebody because my limited knowledge about what would be happening in the procedure, I didn't want my teeth to be filed all the way down. I wanted just something to be applied on top of them. It was difficult to find somebody who would do that. And you know what? I don't even know. I think I closed my eyes and just said, go for it. I'm not really sure how much filing was done. And Dr. Sokolina, you can explain to us what, I guess, the difference would be in those two procedures and why.
And now they don't do that anymore. I got mine filed down. And you can tell if you put a mirror behind your teeth, you can see your original tooth. You can't feel it, but you can see, just take a mirror. But anyway, now, of course, I got mine filed down. And then like a month later, they came out with the ones where you don't have to. So I have this fear of losing my veneer and just having these little sticks for teeth. And I'm in the middle of a party and everyone can see me. That's my nightmare. It's a recurring nightmare.
I hope it's not gonna happen.
Me
I hope
too.
they're just gonna stay.
Me too. Oh my God.
So tell us, Dr. Sokolina, what is the difference between that and how that all works with those two different procedures?
So there are big difference. You can have crowns when your teeth need to be prepped and the tooth gonna be covered 360 degrees. And there are veneers. Veneers can be done in two ways. It can be prep of the tooth, to create the space for the porcelain zirconia restoration to be bonded to that. And it also can be done veneers without prep. And I don't know, there are different techniques how people do that. But for me, the teeth underneath need to be prepared. First of all, they have to be straight. For veneers in general, because I want, after I put the restoration, I want to make sure you have a space between your teeth to clean. Otherwise, you're not gonna clean, but bacteria still gonna live in. And a lot of times it was very popular 10 years ago called instant smile. So smile you can get in 2 days. It would be crowded teeth and the dentist would prepare. Yes, of course, we can prepare the teeth and put just like the nails on top of it. But without correct principles, you're just asking for failure. So it has to be straight. And if I want to create a restoration without prepping, I want to have space in between the teeth and between top and bottom teeth because I need to have certain thickness of the material. And then I can only prep around the gum, to have a smooth connection, but it doesn't trap the bacteria next to the gum, which lead to gum inflammation, gingivitis, just like Diana said. And you're right to say about dance. My profession is a very delicate tango. So I have to dance with my partner and, react to every move.
Do you find there's a lot of dentists that aren't taking as good of care and that consideration, and there's too much crowding and they're not giving enough room for them to floss?
Dentistry is very isolated profession. Don't practice alone. Of course, I have a couple partners who practice with me. They follow the same philosophy because they're in my office. They have to have the same principles. So I train them like how I want it to be in my office. Yes, I do meet patients who come from other offices and they do have different principles applied. And I usually say to my patient, I don't know the circumstances it was done. We start developing of history without bashing somebody else. We start from that moment they met me.
Yeah.
So I have to be very considerate and dance that dance, look what situation is and how I can correct it.
I know that sometimes it's a trend, what our teeth look like. What is trending for teeth? Bigger front teeth, or do sometimes people want enlarged canines or something that is more dramatic because they think that that is more aesthetically pleasing? When you're starting that process with somebody to find the shapes of their teeth for that perfect smile, what are some of the things that you come up with?
So I design the smile using the models. We can take impression to the models, and then I change it how I aesthetically feel this person based on my artistic, ideas should look like. And, talking about size of the teeth, how I like canines and lateral and center look like, how wide it should be, how, thick, whatever. Because I want to incorporate all the beautiful ideas my patient might have about the smile right on a teeth. So they take a mirror and they talk to me. Or I want my teeth longer. No, it's too long. I want them shorter. Or I don't want square teeth. I want them round. I want my canines to be triangle. I want my canines to be straight. Or I want my lateral to be shorter because I want to look younger. So there are so many deviations from the norm.
So what was your reference to a tooth shape where people say because they want to look younger? What was that you said?
When the laterals a little bit shorter than the centrals, when they don't look like a piano keys.
We're looking at our.
Yeah. So that's what my doctor said. Yeah, those are going to be less than the center ones. That's a more youthful kind of younger look.
And why is that?
That's the standard because it's a Leonardo da Vinci golden proportion. The central and the lateral have to have a relationship like 8 and 6, size-wise.
Yours are lower.
Do younger people have smaller ones? Like, is there
It's a smaller and a little bit shorter.
Yeah.
And a lot of people don't want that. They want it the same length. That's the beauty concept. So there is no unique principles. We're all different.
Is there anything after you get your veneers? Should you still be whitening them, or is there something we can do at home that's natural? Like, does baking soda work, or someone with sensitive teeth?
Okay, the veneers, it's a porcelain restoration from outside, and you can whiten it all day long. It's not gonna whiten because the porcelain does not change color as well as zirconia. Yes, people can have a stains and they can use whitening to remove the stains, but not the material itself. It might disappear with the brushing, and baking soda, just like we mentioned, because it's quite abrasive material and it, remove. And if they have a sleep apnea, they have to address it because desire to breathe gonna be so much bigger than the desire to be beautiful.
Okay. So let's talk about that. So I think a lot of people have sleep apnea that don't realize that.
Yes.
Is it safe to say that people who snore or keep their mouth open when they sleep have sleep apnea? Is that fair?
We cannot give that direct conclusion. It's always have to be checked with a sleep study. But because your podcast is for women, I want to tell all the women what
Tell us.
the statistics. 24% of the males in United States have sleep apnea and 17% of women. But I don't know if it's totally true, those numbers, because a lot of women not diagnosed because women don't have a tendency to snore. Women usually show the signs of sleep apnea through depression and anxiety and migraines. So those particular symptoms get treated with a pill. Take the pill or don't be lazy. That's what very common story, what females might not be diagnosed. But I'll tell you this, it's so interesting to me in Japan and Germany, the little bit different standard of care or preventative care than here in United States. There are 50% of population who have sleep apnea. So, when I think about numbers, it makes me wonder.
Right.
That's the numbers, and it's just something to think about. And if, I'm talking to your audience, if someone has if someone snore or sleep next to snoring partner, it might be a red flag. If you're tired, you can ask your doctor, I'm tired. And I don't know.
Where's the connection? Sleep apnea and your mouth. What happened?
Yeah. we design our body so smart. I've been a doctor, for many years. And I can still, and I've had fascination with the human body as a child, and it's still very active. So I always think how our body trying to tell us or trying to save us from dying. So if we cannot breathe at night and our airway get closed with our tongue when we open our mouth to breathe, then the body moves the jaw forward to open the airway. And a lot of people ask me that funny question. I mouth breathe. How can I grind? Why? Like, I don't grind. My mouth is open. Yeah, but when you cannot breathe, when your tongue gets into the airway, that time you do close your mouth and move the jaw forward. It's a certain muscle response to that event, to the apneic event.
Is that the danger, is that your jaw comes forward and then you grind your teeth? That's the problem with sleep apnea, or is there more?
The problem with sleep apnea, it's actually the response of the body. Sleep apnea, it's, the airway get closed and your body perceive it like it's choking. And it's a big stress, we don't want to be strangled and, lose our breath. Then, so body thinks I'm in danger. Blood pressure goes up, heart rate goes up, heart start beating much faster. And somebody has a sleep apnea, huge correlation with atrial fibrillation. But atrial fibrillation can lead to ventricular fibrillation. Usually, it's a different part of the heart. If the, ventricular part of the heart start losing the orientation, that can lead to cardiac death. A lot of strokes and heart attack, they happen early in the morning because, heart was, fighting with sleep apnea. We put it in a simple way. And sometimes from that high blood pressure and high heart rate, the blood clot become loose. And they can go anywhere. They can go into carotid artery and cause stroke. They can go in the heart and cause heart attack. A lot of those tragic accidents happen early in the morning after, body already fight with the sleep apnea enough.
It's also fascinating because, starting a conversation where we're thinking, okay, let's dive into the aesthetics of a smile related to beauty, but we can't separate structure and function. We can't separate that. And especially when we're talking to a demographic, that is our podcast, where we have middle-aged women listening, and they are going through so many of these things symptomatically and being treated possibly by their doctors by being given antidepressants or pills for sleep to help them sleep. And yet there's so many different things that are related to all, including menopause, related to all of these things that are starting to happening to our bodies. And they're centered around, in many cases, as you've been pointing out, the mouth. So really, health and beauty, as Diane and I have discussed previously, are so intertwined. And you've made some fascinating points. What are the most exciting things right now in terms of innovation, whether it's including digital design, the materials, new protocols and products? What's on the horizon?
Tell you what excites me. My friend is working hard to bring a lot of artificial intelligence into dentistry. And her name is Dr. Alderman. I think that's great because it can help us as a professional to deliver better care to patients. And maybe AI can change the way, people think about dentistry. And, by the way, I talk about dental innovation and sleep apnea innovation and all of that on my program. I do have a Facebook group called Sleep Apnea, Breathing, Snoring, Health. And I have Instagram, Dr. Maria Sokolina. And, I send you the link and give it to your audience. And I have YouTube channel for people who don't have that. And I talk about innovations. Now, when I come to my practice and open the charts and see people on the screen, they give me the bouquet of the disease. And it's usually the same: high blood pressure, asthma, allergy, depression, anxiety, thyroid issues, and sleep apnea. And when people really want to have a change and they had some orthodontic treatment and they notice what face kind of fall, Yes, we can do fillers here, but if you did not develop middle part of the face because your jaw is very narrow, if your jaw is very narrow, you're not gonna have a zygomatic bone, and your face not gonna look like a triangle. But we want a triangle. We want that U type of appearance. Yes, we can do it with a soft tissue. We can do just like my friend, Dr. Kathy Kennedy, with the exercise and develop the muscles. Yes, it's all.
Yeah.
Yeah, that's all great ways for adults. If we might not get enough width, you can go to the surgical round, surgical orthodontic round. You can have orthodontic surgery when they open things up, and then you do orthodontics to make your smile in the way you want to, and then prosthetic. Or you can do expansion, surgical expansion. It's called MARPI. It's an expander. First, they open up the jaw in the middle, and then they expand it. Then your smile look like it should look.
Wow.
And it's also plays significant role in eliminate, cure for sleep apnea.
When is your book coming out? When can we expect?
My book coming out in May 2026. And it's a story, it's a fiction because it's a cumulative stories, dentistry, how I see it, aesthetic and all of that. And of course, sleep apnea and evolution, why we got to that point, and processed food and different aspects of treatment, what you can do. I put it in a story form. I put in a story of the family because we don't live in a scientific book. We live through human lives, and we live through family lives, relationship, but also affected by sleep apnea so much. That's actually number one reason what men searching for treatment, because first they're searching for performance. The situation with the sleep apnea
Sexual
happened.
performance.
Sexual performance.
Okay. That's a motivator.
It's a very strong motivator to look for sleep apnea treatment, because as soon as they go to urologist for medications, sleep studies should be the first step towards that treatment, as well as for hormone replacement therapy. Because if you have a sleep apnea and you get the medications, it's gonna make a sleep apnea worse.
Okay.
Oh,
And
okay,
the
ladies.
desire, not gonna be. If you're tired, it's not
True,
gonna
too.
be a great desire.
Yeah.
Absolutely.
But
It's
it applies to women as well. A loss of libido in the case of sleep apnea.
right.
That's also a story.
Yeah.
That's huge. This is news, ladies. You got some things to share with your partner there.
No blue pill first. Yes, you have to
No
check,
blue pill.
because all this tiredness, or maybe you consider as laziness, or that grumpy response might have a deep roots. That's all I put in my book. That's how love can treat
What is the
everything.
title of your book?
Breathless Awakening.
Breathless Awakening. That's wonderful. So that's something that that we can anticipate for March of 2026.
May.
That is very exciting. And you've
Yep.
gone over some of the other places that people can find you too. You do have information on YouTube.
Yes,
Can you go through that for everybody?
Yes, I have Instagram, Dr. Maria Sokolina. Yeah, Dr. Maria Sokolina. I have a Facebook group. I would be so honored if you join my Facebook group. And I work with a lot
We
of
will do
different
that.
products what can help in a sleep apnea. And I put, discounts. So if you're part of my group, you can use that. And I have a YouTube channel, same name, Sleep Apnea, Breathing, Snoring, Health. And I have LinkedIn, for professional people. I also put, a lot of people don't have other accounts, but under my name, Maria Sokolina, I have that. And I know I have a TikTok account, but, I personally don't participate in that. But my social media manager, she put information on TikTok as well. And I would be
You have
so
a lot of
happy.
places.
Yeah, I have, because I think I have important message, and in a way I look at that, I want to make my colleagues or maybe younger dentists excited about that. What they can, it's a very common what dentists get burned out, because when people come to you and say, I hate dentists, that's not easy. You have to have a very thick skin and a lot of interest.
And you're changing that.
I really hope so. So
Yeah, you are.
that's why I have so many, social media channels. But I want to tell about these two beautiful hosts, Diana and Carolyn. I really appreciate your comments on my Instagram and all your likes. They mean a lot to me. And, chance what I have an opportunity to talk. So thank you very much. And I really enjoy my time with you. And if I can help your listeners, let me know.
You've been an absolute delight, and you've provided us with some fascinating information.
Thank you.
And we appreciate that. We'll be putting the details of the website as well as to how to get in touch with you.
I want to mention about the gifts. If some of your listeners suffer from jaw joint, a lot of people, it's very common for females to suffer because, estrogen have a lot to do with that. I put, as my gift to you, I put the assessment for temporomandibular joint disorders. You can not self-diagnose, you need a professional, but to get an idea, maybe it's that. And then I put the bonus video, what you can do to help you. And second thing, if you into physical therapy, just like Dr. Kennedy explained on her podcast, I a big proponent of myofunctional therapy, and I put assessment how myofunctional therapy can help you with sleep. So you can take your assessment and then have a bonus video from that.
And that was wonderful. Yeah. Thank you for including those. And we so appreciate you for doing that. Thank you.
Thank you.
Dr. Maria Sokolina, we are also thankful and appreciative to have you on. So thank you very much. We're going to have all of your information on our show notes. For everyone listening, thank you so much. If you could subscribe and like, we would appreciate it and be indebted to you forever. So thanks for joining us, everyone. We'll see you next time. And make sure you drink your apple cider vinegar, or is that good for your teeth?
I think it's good.
Good.
Yes, it has acidic, but I think it has a actually different effect. So I'm very honored. Thank you very much. I really enjoy my time with you.
Awesome. All right. Take care.
Thank you.
Bye-bye.
Till next time, keep being your badass selves.